Okay, let's dive in. Today, we're tackling a really key health number, cholesterol. We've been looking at a guide from the Blood Test UK website, and we want to make it super relevant for everyone listening, especially if you're in or around Gloucester.
Exactly. Our mission really is to cut through the jargon. We want to get straight to why this simple test is so important for your heart, and do it quickly, in plain English.
So cholesterol, we hear waxy substance a lot, right? But maybe think of it like this. Your body needs it, but it's about how much and where it ends up. Too much of the wrong kind starts, sticking to the insides of your arteries, like little sticky patches.
Plaque, we call it. And that buildup, that narrowing of the arteries, that's the real danger zone.
Why exactly?
Because if that flow gets blocked, suddenly you're looking at really serious problems, things like heart attacks or even strokes. That's fundamentally why we test.
Okay. And the sources, they really hammer home the benefit of finding out early, don't they?
Absolutely. Testing regularly isn't just, getting a number back. It's being proactive. It gives you that crucial chance to make changes before it becomes a major health crisis.
So it actively lowers your risk of those big events, heart attacks and strokes?
Significantly, yes. The data shows that. It's about taking control.
How often should people be thinking about this then?
Well, for most adults, a check every, say, 4 to 6 years is generally recommended. But, and this is important, if you've got other risk factors, maybe diabetes or high blood pressure.
Or if heart problems run in the family.
Exactly. If there's a strong family history, then you need to be checking much more often, maybe even yearly. Genetics can really play a big part here, making those regular checks even more vital.
Okay, so if you know you need the test, what about getting it right? The source material mentions preparation is key for accuracy.
It really is.
Yeah.
The biggest thing, the non-negotiable part, is fasting. You need to go about 9, maybe 12 hours with absolutely nothing except water before the blood draw.
Nothing at all. Why is that so strict?
It's mainly for one specific part of the test. Triglycerides. They're a type of fat in your blood that comes directly from food you've recently eaten.
Ah, I see. So if you just ate, the level would be artificially high.
Precisely. It would give a misleading picture of your usual levels. Fasting gives that baseline, accurate reading. Also, be sure to tell whoever's doing the test about any medications you're on. Things like beta blockers or diuretics sometimes, they can actually shift your results a bit.
Good point. Important to mention those. Now let's talk specifics for Gloucester. Where can people actually go to get this done?
You've got options. There are the main NHS centers, like Gloucester Health Center or Western Community Hospital. Standard places.
Okay.
But don't forget local pharmacies. Many offer cholesterol testing now, and sometimes they can be, faster and just more convenient to pop in there.
Right, good to know there are choices. So you get the results back. What do the numbers actually mean in simple terms? HDL, LDL?
Okay, think of it like this. LDL is often called the bad cholesterol. It's the stuff that carries cholesterol to your arteries where it can build up.
The sticky stuff.
Yeah, the stuff that causes the blockages. Then you have HDL. That's the good cholesterol. It acts more like a cleanup crew. It actually picks up excess cholesterol from the arteries and takes it away to be processed.
So one builds up, the other clears out. That makes sense.
That difference is really the core of it.
So wrapping this up then, what's the big takeaway for people listening?
I think the main point is that knowing your levels, your LDL, HDL, triglycerides, that knowledge is power. It's the real motivator for making changes.
Like improving your diet, cutting down saturated fats, getting more exercise.
Exactly. You can't manage what you don't measure, right? Knowing the numbers gives you that starting point, that push.
Okay, makes sense.
And maybe just one final thought to leave you with, connecting back to genetics. We mentioned family history can be a big risk factor. So the question is, if you do have that strong inherited risk, how much impact can lifestyle changes like diet and exercise realistically have? Can they fully overcome what you've inherited? Or, what point does the conversation need to shift towards medication to really manage that long-term risk? Something to consider.